Three of America's most common blood pressure pills can quietly swell your ankles, trigger a cough that lasts for months, or push your potassium too high. And many people are never told. Look at your blood pressure bottle. Does it say Amlodipine, Losartan, or Lisinopril? You may have swallowed that same tablet for years. Your numbers improved. The prescription kept getting renewed, and nobody had time to explain what the medicine was actually doing. Then something changed. Your ankles began to swell. A dry cough would not go away. You felt lightheaded when you stood. Or a blood test showed that your potassium or kidney numbers had shifted. Those changes may contain useful information about your medicine, dose, or combination. Today, I will explain 7 things every adult over 60 should know about Amlodipine, Losartan, and Lisinopril, including one warning that should never wait for a routine appointment. If you have noticed one of these changes, you are not imagining it. A side effect does not mean a medicine is bad or that you failed treatment. It means the treatment may need to be reviewed alongside your age, kidney function, other medicines, hydration, and home readings. After 60, several small factors can overlap. A new water pill, poor appetite, an over-the-counter pain reliever, and a blood pressure medicine may each seem harmless alone. Together, they can change how you feel. The goal is understanding, not fear. I am Dr. Daniel Mercer. On this channel, I take real medical evidence and explain it in plain, practical language, so you can have a better conversation with your healthcare team. We will cover how these medicines lower pressure, why Amlodipine can swell your ankles, why Lisinopril can cause a stubborn cough, why Losartan is different, how potassium and kidney tests fit in, what dizziness and medication timing really mean, and which drugstore products can interfere. I am not selling a supplement, a course, or a miracle plan. Near the end, I will give you 3 exact questions to take to your next appointment. The final question can prevent a common misunderstanding about when to take your pill. Before we begin, tell me where you are watching from and which name is on your bottle: Amlodipine, Losartan, or Lisinopril. Please do not share your dose or private medical information. The medication name alone will show me which one deserves a deeper follow-up. I am not telling you to stop, skip, split, or change any medicine. Uncontrolled high blood pressure can damage the brain, heart, blood vessels, eyes, and kidneys, often without causing a warning symptom. These medicines do important work. A normal reading may mean the treatment is working, not that you no longer need it. Use this information to recognize patterns and ask better questions. Changes in dose or schedule belong in a conversation with your prescriber or pharmacist. Imagine your blood vessels as a garden hose. When the muscular wall tightens, the passage narrows and pressure rises. When it relaxes, blood has more room to move. Amlodipine is a calcium channel blocker, a medicine that reduces a calcium signal telling the muscle around your arteries to contract, allowing those arteries to relax. Losartan is an angiotensin receptor blocker, or ARB, a medicine that blocks a vessel-tightening message. The hormone angiotensin II tells blood vessels to tighten and the body to retain sodium and water. Losartan blocks the receiving dock for that message. Lisinopril is an ACE inhibitor, a medicine that reduces production of that same tightening message. Less angiotensin II is made, so the vessels relax. Losartan and Lisinopril affect the same hormone system at different points. Amlodipine uses another pathway. That is why their side effects differ. A swollen ankle on Amlodipine, a dry cough on Lisinopril, and a potassium change on Losartan are clues to different mechanisms. Amlodipine's best-known side effect is peripheral edema, swelling around the ankles or lower legs that may leave a dent when pressed. This is not always simple water retention. Amlodipine relaxes the small arteries carrying blood into the tiny vessels of your legs. If the vessels carrying blood away do not widen equally, pressure rises and pushes fluid into nearby tissue. Imagine a typical case. Someone starts Amlodipine and later notices deep sock marks. Shoes fit in the morning but feel tight by dinner. Both ankles look puffy, and the swelling improves overnight. The person assumes it is age or salt and never mentions it. The official prescribing information identifies edema as amlodipine's most common adverse reaction and shows that it becomes more frequent at higher doses. Not every swollen ankle comes from amlodipine. Heart, kidney, liver, vein, and lymph problems can also cause swelling. New swelling on one side, redness or pain, or swelling with shortness of breath needs prompt evaluation. If both ankles began swelling after amlodipine was started or increased, ask whether the timing and dose could be connected. When amlodipine is responsible, swelling often improves after a clinician adjusts the treatment plan. Headache, flushing, and lightheadedness may appear when treatment begins or the dose rises. Lisinopril blocks an enzyme that helps make angiotensin II, but that enzyme also breaks down bradykinin, a natural substance that can irritate the cough pathways when it builds up. The result is often a dry, tickling cough with no mucus or fever. Some people constantly clear their throat. Others notice it more at night or while speaking. Studies report ACE inhibitor cough in roughly 5 to 35% of patients. The range varies by population and study method, but the effect is common enough to consider. It may begin within hours or several months after treatment starts. Imagine a typical case. Someone takes lisinopril for 6 months, develops a dry cough in the fall, and spends the winter blaming allergies or a cold. Because the prescription was not new, nobody connects the two. Tell the prescriber when the cough began and whether it is dry. If lisinopril is responsible, another class may be considered. Losartan is often discussed because ARBs generally do not produce the same bradykinin cough. Lisinopril can also cause angioedema, sudden, deep swelling of the lips, tongue, face, or throat. It is rare but urgent, and we will cover it in the red flag section. If you have ever been told a lisinopril cough was just a cold, type the word cough below. I want to see how common this is. Losartan blocks the angiotensin receptor instead of the ACE enzyme, so it does not usually cause the classic bradykinin cough. That makes it a common alternative when an ACE inhibitor is not tolerated. But it can still cause dizziness or weakness, especially with dehydration, vomiting, diarrhea, a water pill, or a sudden reduction in salt. It can also raise potassium and change kidney function in susceptible people. Imagine someone taking Losartan and a water pill during a hot week. They spend time outside, eat less, and drink less. The dose has not suddenly become poisonous. The situation around it has changed. Heat, fluid loss, and 2 pressure-lowering medicines can combine. A medication review should therefore include every prescription, drugstore product, supplement, recent illness, and home reading. Lisinopril and Losartan are generally not combined merely because one pill is not enough. Blocking the same system twice can increase low pressure, high potassium, and kidney injury without routine added benefit. If both names appear on your active list, ask your pharmacist or prescriber to reconcile it. Potassium helps nerve and muscle cells carry electrical signals. Your heartbeat depends on it staying within a controlled range. Too little is a problem, but too much can also disturb the rhythm. Losartan and lisinopril can reduce the hormone signals that help the kidneys remove potassium. The risk rises with kidney disease, diabetes, dehydration, heart failure, potassium supplements, certain water pills, and other medicines that raise potassium. Imagine a typical case. Someone replaces table salt with a heart-healthy salt substitute, not realizing that it contains potassium chloride. That may help some people reduce sodium, but it is not automatically safe for everyone taking an ACE inhibitor or ARB. If you watched our earlier video about everyday healthy habits that can strain the heart, this is the direct connection to the salt substitute warning. The National Kidney Foundation notes that many salt substitutes contain substantial potassium and identifies ACE inhibitors and ARBs among medicines that can contribute to high potassium. The official labels for Lisinopril and Losartan also call for potassium and kidney function monitoring in people at risk. Do not invent a low-potassium diet or remove fruits and vegetables merely because you heard the word potassium. Ask whether you need testing and whether a supplement, salt substitute, or other medicine changes your risk. Losartan and Lisinopril can protect the kidneys in certain people, including some with diabetes or protein leaking into the urine. Yet they can also change creatinine, a blood marker of kidney filtering, and potassium, especially during dehydration or reduced kidney function. A clinician must interpret those laboratory changes. High potassium often causes no reliable early symptom, which is why blood testing matters. Severe weakness, a new abnormal heartbeat sensation, fainting, chest pain, or shortness of breath needs urgent assessment but cannot diagnose potassium at home. Have you had a potassium test this year? Yes or no in the comments. If blood pressure falls too far or drops when you stand, you may experience orthostatic hypotension, the dizzy drop you feel after standing too quickly. You may feel unsteady, weak, or notice your vision dim for a moment. After 60, the immediate concern is a fall. All three medicines can contribute to lightheadedness, especially with water pills, dehydration, heat, or other pressure-lowering drugs. Imagine a typical morning. Someone takes a blood pressure pill and a water pill, drinks coffee, and begins working without food or water. After tying a shoe, they stand and the room tilts. They grab the wall and assume balance simply worsens with age. Record when it happened, which medicines you had taken, whether you had eaten, and, if it is safe, your seated blood pressure and pulse. A clinician may also check your pressure after standing. Do not deliberately provoke severe dizziness. Would moving the pill to nighttime fix it? There is no universal best hour. In the large randomized time trial, taking usual blood pressure medicines in the evening did not improve major cardiovascular outcomes compared with morning dosing. Your symptoms, bathroom trips, other medicines, home readings, and ability to remember the dose can influence the schedule. Consistency is often more important than chasing a universal rule. Do you take your pill in the morning or at night? I am curious what most of you do. Nonsteroidal anti-inflammatory drugs, or NSAIDs, common pain relievers such as ibuprofen and naproxen, can matter with Losartan or Lisinopril. In an older adult who is dehydrated, taking a water pill, or living with kidney disease, NSAIDs can weaken the blood pressure effect and increase the risk of kidney problems. Imagine a typical case. Someone takes ibuprofen only when a knee hurts and never lists it as a medicine. The prescriber sees rising pressure or a kidney number change, but does not know about the drugstore tablets. Over-the-counter does not mean irrelevant. Ask a pharmacist which pain options fit your history. Check cold and sinus labels too, because some decongestants, medicines that open a stuffy nose, can raise blood pressure or heart rate. A poor home reading can create another false alarm. A cuff that is too small, placed over clothing, or hanging below heart level may produce an inaccurate number. Talking, crossing your legs, rushing in after exercise, drinking coffee, or measuring with a full bladder can also affect it. Use a validated upper arm monitor with the correct cuff size. Avoid caffeine, smoking, and exercise for 30 minutes. Empty your bladder. Sit quietly for 5 minutes with your back supported, feet flat, and legs uncrossed. Put the cuff on bare skin, support your arm at heart level, and do not talk. Take 2 readings 1 minute apart and record both. One number is a snapshot. A correctly collected log gives your clinician the pattern. Most medication questions belong in a routine call or appointment. These do not. If you take Lisinopril and develop sudden swelling of your lips, tongue, face, or throat, especially with trouble breathing, trouble swallowing, a tight throat, or a change in your voice, call 911. Do not drive yourself, and do not wait to see whether it passes. Angioedema is rare, but it can obstruct the airway. Call 911 for fainting that does not quickly resolve, chest pain, severe shortness of breath, new one-sided weakness, facial droop, or difficulty speaking. If your blood pressure is higher than 180/120, wait at least 1 minute and measure again correctly. If it remains that high and you also have chest pain, shortness of breath, weakness, numbness, vision change, back pain, or difficulty speaking, the American Heart Association advises calling 911. High potassium often has no warning symptom. But if you have been told that your potassium is high and then develops severe muscle weakness, a new irregular heartbeat sensation, fainting, chest pain, or shortness of breath, seek emergency help. New swelling in only one leg with pain, redness, or warmth also needs prompt assessment. So does swelling in both legs accompanied by new breathlessness, rapid weight gain, or difficulty lying flat? For non-emergency, but significant dizziness, repeated near falls, persistent dry cough, new ankle swelling, or a change in urination, contact your healthcare team rather than silently waiting for the next annual visit. Here are the 3 questions to save, print, or take to your next appointment. Question 1. Could my ankle swelling, cough, or dizziness be related to this medicine or its dose? And what other causes should we rule out? That wording does not assume the medicine is guilty. It asks the clinician to connect the symptom, timing, dose, and other possible causes. Question 2. When should my potassium and kidney function be checked, and do any of my medicines, supplements, or salt substitutes change that plan? Bring every product or clear photographs of its labels. A clinician cannot assess an interaction they do not know exists. Question 3. Based on my home readings and symptoms, is my current dose and time of day still the best fit for me? A number may look excellent while you feel faint every afternoon, or you may feel fine while your average pressure remains too high. Both pieces matter. For the week before your appointment, unless your clinician has given different instructions, measure at consistent times. Take 2 readings 1 minute apart. Record the numbers, pulse, medication time, and symptoms such as dizziness, swelling, or cough. Do not change a dose because of one reading. Bring the monitor to an appointment at least once so the office can check the cuff size, your technique, and its accuracy. I have placed these questions in a clean checklist below the video. Myth 1. My pressure is normal today, so I can skip the pill. A normal number often means the plan is working. If readings are repeatedly low or symptoms appear, call the prescriber rather than running a day-to-day dosing experiment. Myth 2. A lisinopril cough must be a cold. It may be a cold, reflux, allergy, asthma, or another condition. But an ACE inhibitor can cause a dry cough even months after the prescription begins. Myth 3. Swollen ankles are simply part of getting older. They are not a diagnosis. Amlodipine can contribute, but so can vein disease, heart or kidney problems, liver disease, a clot, and other medicines. The pattern and examination matter. You deserve to know more about a daily medicine than its color and the time you swallow it. When you combine accurate readings, a complete medication list, and the right questions, you become a safer and more effective partner in your care. It is never too late to understand what your medicine is doing and what deserves a second look. If this explanation helped you, subscribe to Dr. Daniel Mercer for calm, evidence-based heart health guidance after 60. In the comments, tell me which medicine you want covered next. And watch the next video, because we are going to explain what heat and dehydration can do when they meet blood pressure medicine and the 5 mistakes older adults should avoid on very hot days.